Child Focus serves over 5,000 youth, ages prenatal to young adulthood annually. We provide early learning, mental health, school-based, foster care, and community services. Our mental health programs provide traditional outpatient, individual, family, and group therapy, case management, diagnostic, psychiatric services, and partial hospitalization. Our early learning programs focus on providing child care center and home-based services for children birth to 5, and we also provide enrichment opportunities for children ages kindergarten through 2nd grade.
Child Focus has been providing mental health services to the early childhood population since we opened our doors. Funding for the early childhood mental health program started small, with the Claremont County Mental Health Board supporting our need request and allocating some prevention dollars to aid in classroom management of these difficult problems. As we began to formalize our services, we started with 2 independent contractors who worked 10 hours a week, providing prevention and consultation to early learning classrooms. Shortly after the Mental Health Board allocated some dollars for this population, Child Focus received a grant from the Ohio Department of Mental Health. These initial dollars have increased and been leveraged to obtain funding from other sources, including SAMHSA and United Way. I'm pleased to say that this is a program that has been growing ever since that initial seed money and always evolving to meet the needs of the children in the classrooms that we serve. So from those 2 10-hour-per-week independent contractors, we've now grown to 5 full-time positions that provide therapy, prevention, consultation, and training. With the resources provided to this mental health and early childhood initiative, Child Focus has been able to positively impact the lives of young children. We help them promote healthy relationships, improve their behavioral and emotional functioning, and thus drastically increasing the likelihood of their future success in school and in life.
Child Focus's mental health and early childhood services focus on providing prevention, consultation, and treatment services for children birth to 6. We provide a range of services for Claremont County, Brown County, and Adams County through a partnership with our Head Start programs and community child care centers. We were recently granted the Race to the Top Early Learning Challenge grant through the state of Ohio, which has allowed us to partner with the Young Child Institute as well as Tri-County Mental Health Services to serve 16 counties in the Southern Ohio region. For our consultation and prevention services, we work from what's called the Positive Behavior Supports Pyramid, which means we focus on classroom consultation and the overall environment to increase the skill set of teaching staff so that they can provide a very high quality environment for children. We also work with teaching staff to increase social emotional supports throughout the classroom so that all children in the classroom can benefit from our services. We're also able to provide more specific targeted interventions for kids who might be struggling to maintain their behaviors in the classroom. We develop individualized plans to help these children be more successful and increase their positive experiences in the classroom. To do this, we collaborate with teaching staff and parents to develop a plan that's going to meet the child's individual goals. The last level of care and the most intensive level of care that we can offer children is our outpatient therapy services. Child Focus has a team of specialized therapists who work with children under the age of 6. In order to do this effectively, we use treatment modalities such as play therapy and trauma-focused cognitive behavioral therapy to decrease the mental health symptoms that children have. So we're learning more and more from neuroscience about the impact that things like trauma and chronic stress can have on a child's brain development. So it's become one of our program goals to help the community at large be more trauma-informed so that early childhood educators can really create a positive and nurturing environment for children. Because what we also know from neuroscience is that things like a nurturing relationship and positive environment can have a positive impact on brain development. It's become one of our goals to be more trauma-informed through all levels of care, from our prevention services up through our treatment services. We have a team of clinicians who's trained in trauma-focused cognitive behavioral therapy so that they can really work most effectively with these young children who have trauma histories.
Our approach to working with young children is research and strengths-based. We promote the development of social and emotional skills, and these skills have been linked to success in school and in life. The Devereaux Foundation terms these skills protective factors. They're closely tied to the concept of resilience, which is the ability to bounce back from stress. There are 3 protective factors: initiative, self-control, and attachment. And these come out of a research base by Paul LaBeouf and others at the Devereaux Foundation. We use the DECA assessment to measure these protective factors in children ages 0 to 5. And from the DECA assessment, we determine whether or not their skills are at a typical level or at a level where they need some assistance to improve them to get back up into the typical range. We then develop intervention plans with these concepts in mind, building upon the strengths. And we also pull from the Incredible Years, the Center for Social Emotional Foundations for Early Learning, Conscious Discipline, and Parent-Child Interaction Therapy to develop strategies for working with young children. Our goal is to increase social and emotional skills and to decrease behavior concerns. And we measure our outcomes also using the DECA.
Early childhood therapists can be key in providing the support that a child may need in the classroom, that a teacher needs in the classroom, in partnership with parents to help identify some strategies that can begin to be implemented in the classroom setting as well as in the home environment. They bridge the connection between home and the child care setting or the Head Start setting.
From our standpoint, there's simply nothing more important than helping our young people get ready to succeed in life, starting at a very early age. It's a smart investment, but it's also the right thing to do. We know that some 90% of a child's brain develops by the time they're 5, and that those early experiences with parents, with caregivers, with other adults can make all the difference.
Parent involvement is key to effective interventions with young children. Parents are involved from the beginning of the process, from the minute the teacher asks for help in the classroom or suggests that one of the kids in their classroom is struggling. Parents are experts. We believe that they are key to change happening and effective change because they know their child better than anyone else.
When I first called to ask for help in the program, he was about to get kicked out of school. That was our biggest concern. At the time, his behavior wasn't at home, so it was at school, and he was on the verge of getting kicked out for randomly hitting other kids. The first technique that they taught the teachers was when he gets really upset, when you tell him no or tell him not to do something, then he rips up paper. So it was one of those strategies that, if he's angry, it gives him something to do for his body and his hands until he can calm himself down, which just something as simple as that, which you would think that a parent could think of or a teacher could think of. It was just, that helpful reinforcement was very, very helpful and very nice.
They have been very supportive in helping me refine my techniques that I use in my classroom for my classroom management. I think that's a very valuable tool for me, honestly, as a teacher. And some of the other ways that they've just helped me is just with the resources that they've provided with me. I have books because they've suggested them to me. Not just in my classroom, but some of their books that I love so much I've had to buy for my own personal use.
So many children in this community were being identified with problems at preschool, at daycare centers, and the easy way to deal with that was simply to kick them out. And clearly what we wanted was to have those issues addressed, that parents could learn how to help their children, teachers and other staff in child-serving agencies could help, and then the children would get the supports they need to be successful in school and in life, and hopefully prevent serious problems later on.
Mental health early childhood wouldn't be where it is today were it not for the many collaborations and partnerships that we have had and developed over the years. Nor would we be here without the creative and dedicated staff that you saw in the video. Hopefully this video will help you understand the critical issues that are involved here and also then assist you in the development of these services within your own community.